In this video, we review high-yield psychiatry cases focused on key clinical presentations frequently tested on exams. We will break down each scenario step by step to help you identify diagnoses and understand management clearly and efficiently. Case 1: we have a 62-year-old woman who comes to the office for worsening hypertension. The patient admits that she is not taking her antihypertensive medication. She feels fine and says that she always listens to her body rhythms when deciding whether to take medication on a particular day. She also mentions that she has crystal jewelry with healing powers, and she participates in an online forum about the health benefits of crystals. The patient does not trust most people and believes that she can predict the weather based on the number of birds in her yard. She lives alone, has a few friends, and is unemployed. On examination, the patient makes limited eye contact and appears mildly anxious. She has no auditory hallucinations, and no specific delusions are elicited. The question is, what is the most likely explanation for this clinical presentation? In this case, the patient has schizotypal personality disorder. This patient's eccentric behavior, odd thoughts, perceptual distortions such as belief in bodily rhythms, and social anxiety are consistent with schizotypal personality disorder. Patients with this disorder typically exhibit magical thinking, such as superstitiousness and clairvoyance, along with perceptual disturbances that are subthreshold for a psychotic disorder. These patients do not experience the persistent fixed delusions or frank hallucinations seen in schizophrenia. Schizotypal personality disorder is characterized by a long-standing pattern of eccentric behavior, odd beliefs, perceptual distortions, and social anxiety despite familiarity. Case 2. A 25-year-old man is brought to the emergency department by ambulance after being found sitting in the street drinking his own urine. He says that he is being watched by an unidentified government agency. He subsequently broke up with his girlfriend, quit his job, and disconnected his phone. He no longer seems to care about activities that used to interest him, and last month he moved into the family garden shed with his dog. The patient is malodorous, disheveled, and appears drowsy for no apparent reason. During the interview, he becomes angry and refuses to sit in a chair. Vital signs are normal. Physical examination and laboratory evaluation are normal. What is the most likely diagnosis in this patient? This patient has schizophrenia. His symptoms include delusions, disorganized speech such as loosening of associations and nonsensical words, and grossly disorganized behavior including unpredictable agitation, bizarre actions, and inappropriate affect. He also has functional decline lasting greater than 6 months. Other symptoms may include hallucinations and negative symptoms such as affective flattening, apathy, alogia, anhedonia, and asociality. Schizophrenia has an overall prevalence of approximately 1% worldwide and is slightly more common in men. It typically presents in the early 20s in men and in the late 20s in women. Most patients follow a fluctuating course in which symptoms peak and then diminish, leaving residual symptoms such as mild disorganization, mild negative symptoms, or mild hallucinations at baseline. The treatment of choice for schizophrenia is antipsychotic medication. Diagnosis requires at least 2 of the following symptoms: delusions, hallucinations, disorganized speech, grossly disorganized behavior, and negative symptoms, with a total duration of impairment of at least 6 months.